So this is for patients maybe who had just knee surgery or hip surgery that may be at risk of fall. You can see the device rolls around on 4 casters. It's got a couple of locking casters on the back that you're going to lock during the transfer process. The base opens and closes with a foot pedal on the back so you can get around the wheelchairs and get it between the doorways. Then it's got a couple of seat pads that flip down to support the patient during the transfer process. So I've got a patient here in the wheelchair. I'm going to make a transfer from the wheelchair to the bed. So I'm going to approach the patient with the device, open the base. Patient's going to put their feet on the platform. We're going to bring the device up to the patient's knees. We're going to lock the wheels. Now the patient's going to hold on to the bar and pull themselves up into a standing position. So you can see that the patient's going to need some ability to have some upper body for the device to work. Now the seat pads are going to flip back and the patient can sit back on the seat pads. Now we're going to unlock the casters. And you can see the patient is fully supported. Take the patient to the bed. Lock the wheels again. Patient takes their support off of the seat pads and kind of pulls themselves up a little bit. Remove the seat pads out of the way. Patient can sit down on the bed. Unlock the wheels. And now I've made a transfer with the protector. There's going to be times where a patient isn't going to be able to pull themselves up into a standing position on their own. They're going to need some assistance. And that's what this transfer belt is for. We're going to connect one side of the transfer belt to the hook, bring it around the patient, and put the sliding portion of the belt behind the patient's back. Now, when we ask the patient to help pull themselves up into a standing position, we can use this belt to actually give them a boost to get them into the standing position. Once they're up, we can connect the belt here and provide additional support for the patient during the transfer process.